Hi, my name is Jackie Dubois, and I am a certified nurse midwife based out of Arizona. And today I'm just going to be doing a quick presentation on pregnancy and childbirth in the U.S. And this is just based off some questions that I received from you ladies, just some things you were wondering about. And you can get my email from Jessie or Jennifer after. And if you have any questions for me, you could always email me with further questions. But this is kind of just based off some of those initial questions you sent to me. And so first off is preparing for pregnancy. What you want to do is, when you become pregnant, ideally you start seeing a provider around 6 to 8 weeks after your last menstrual period. And that's so we can do a dating ultrasound to make sure your dates are accurate. You may or may not know your last menstrual period. And so that early dating ultrasound can help us know when your due date is going to be. So I think first and foremost, establish care with an OB or midwife. Decide which hospital you're going to deliver at. Different practices deliver at different hospitals, and I usually recommend choosing a hospital closer to home so that when the time comes for labor, you're not having to drive a long time to get there, because nobody wants to labor in the car. So that's kind of, one thing to consider when you're choosing a practice in the hospital. You want to begin prenatal vitamins, and ideally you begin prenatal vitamins before you even conceive. So if you are planning to become pregnant and you're trying, I would say start them now. Otherwise, it's okay if you haven't, just start them as soon as you can. And they're all pretty much equal. Prenatal vitamins are basically just like a multivitamin with more folic acid, which is for brain development. Some of the prenatals say DHA, which is great too. That's also for brain development. But they're all pretty equal. Your provider could also prescribe some to you, and then you could get them from the pharmacy, and they might be covered that way through insurance. And then basically I just want to run through kind of some important dates and tests throughout your pregnancy. So you want to get that first dating ultrasound. First trimester dating ultrasound like I talked about. Then you want to do your new OB labs. That's looking at your blood type, any infections in the blood, checks for iron levels. Maybe your thyroid will be checked too if you have a history of thyroid disorder. You'll also be offered genetic testing, and every office kind of has different genetic tests they offer. And so these are tests that look for Down syndrome, trisomy 13, 18, microdeletions on the chromosomes, and a lot of them now you can find out the sex of the baby. The one we use in my office is called non-invasive prenatal testing. That is actually good for, you can do it as early as 10 weeks, which is pretty amazing. So ask your doctor or midwife about what tests they offer. And then at 20 weeks, you're going to get the anatomy scan, which looks at all the parts of the baby. So the heart, lungs, arms, legs. If you haven't found out the sex of the baby through some genetic testing, you can find out the sex of the baby now, because actually the genitals are visible around 15 weeks on an ultrasound. Around 28 weeks, you're going to get testing for gestational diabetes. So you drink this sugary drink and they check your blood sugar. And then they'll also recheck your iron levels, because some women can become anemic later in pregnancy. And then you have depending on the practice I work at, we typically do a growth ultrasound between 32 and 34 weeks. But it might depend. Maybe your practice doesn't do that. Some practices do. So you might have that. Around 36 weeks, we do a swab in the vagina called group beta strep, or that's what it looks for, group beta strep, which is a bacteria. I describe to women, like adults, that it's kind of normal flora for us adults, but for babies, if you have it in the vaginal canal, it can cause breathing issues in the newborn after they are delivered. So if a mom has GBS, that bacteria, we treat them with antibiotics in labor so they can't pass it to baby. And then usually we begin checking the cervix around 37 weeks, if you'd like. And at my practice, we offer or recommend induction of labor if you're still pregnant at 41 weeks. So every practice is a little bit different. The practice I worked at before, it was 42 weeks, but you can talk to your provider about the right time for you to be induced if you don't go into labor on your own. Just like quickly, first trimester is the first week to the 13th week. Second trimester, 14 to 27th week, and third trimester, 28 to 40 plus weeks. Usually the first trimester is when you're really tired. You might have that nausea, vomiting, breast tenderness. In the second trimester, a lot of times women feel more energetic, the nausea gets better, they feel really good. You start to feel baby move around like 18 to 22 weeks. And then in the third trimester, you start to get a little more uncomfortable again because the baby's getting bigger, pushing on the bladder, pushing up on the ribs, pushing up on the stomach. So you can't eat as much. You have to kind of eat more small, frequent meals. So that's kind of typically how women feel throughout the pregnancy. As far as third trimester changes, these are all pretty normal. It might seem alarming to you if it's your first baby, but these are all normal. One of them is the Braxton Hicks contractions. That is kind of like painless tightening of the abdomen. So the uterus is a muscle, so it's starting to get ready to go into labor. But it's not, labor contractions are like regular ones that are coming every 5 minutes or less for a good couple of hours. Braxton Hicks contractions will just be random. You might have a couple in the morning, a couple in the afternoon, maybe some when you walk more, or, at doing grocery shopping, but they're not regular. They're not super painful. It's just this tightening that can be slightly uncomfortable. You might experience more shortness of breath because as that uterus grows, it's putting pressure on the diaphragm and you can't take that big, deep breath anymore. So that's normal. Frequent urination, the baby's pushing on the bladder, so you might have to get up multiple times a night, unfortunately, to pee. Lightning crotch. So that is when, there's a point in pregnancy, there's a movement called lightning where the uterus kind of drops down into the pelvis. So then there's more pressure put on the cervix. Baby's head is like bumping up against the cervix, and that can cause like shooting pains in the vagina called lightning crotch. So it might just kind of take your breath away. Usually they're very quick but they can be intense, but very normal. We talk about fetal kick counts when you're about 28 to 32 weeks. We recommend women start these, and that's where you want to measure baby's movement. So you want to feel at least 10 movements in a 2-hour period. And that can be anything from a little whoosh to a big jab. But as you get closer to your due date, the movement kind of slows down a little bit because the baby's really tight squeezed in there. So you might not feel like the big karate chop kicks you were feeling, in your 23, 24, 25 weeks. You can feel a lot of movement then. But it kind of will slow down closer to the due date, but you still want to be getting 10 movements in 2 hours. If you aren't, usually what I tell women is drink something cold and sweet, lay on your left side and kind of play with your belly. If your baby kind of plays back, you're good. If you still don't feel fetal movement, that would be a reason to go to the hospital, okay? Most people will get kind of swollen hands and feet towards the end of the pregnancy. One of the things you can do, hopefully it's where you guys are, it's not too hot. In Phoenix where I am, it's very hot in the summer, so women get very swollen. But just make sure you're drinking lots of water and kind of elevate your feet at the end of the day if they get swollen. You can also wear compression stockings. Well, that will kind of help the fluid from pooling in the ankles and the feet. You might start leaking colostrum, which is the first milk that you'll produce for the baby. This is kind of like liquid gold. It kind of has more fat and more calories in it before the actual milk comes in. So if you start leaking colostrum or breast milk, it's fine. You don't have to collect it or anything. Just, let it kind of leak and wipe it off. That's actually a good sign that you'll have a good production of milk. You might have some heartburn. That can happen earlier in the pregnancy too, but again, as that uterus kind of pushes up on everything, it causes reflux up the esophagus. So very common to have some pretty intense heartburn. Your provider can go over different things you can take, just over-the-counter supplements or medications, but also just don't lay down right after you eat. Don't eat big meals, kind of like more small, frequent, and avoid really spicy and acidic foods. And then you may lose your mucus plug. The mucus plug is kind of in the cervix. So as the cervix starts to open and soften, that might come out. And it's just a lot of mucousy discharge. Sometimes it can be a little blood tinged as well, and that's normal. Losing your mucus plug does not mean you're going into labor. It just means things are starting to change, which is great. But it's not a reason to go to the hospital or anything like that. Next, kind of some nutrition guidelines. When you're pregnant, we recommend an extra 300 calories a day. Talk to your provider just about what your recommended weight gain is, because depending what your weight is coming into the pregnancy, that if you're kind of heavier coming into the pregnancy, they're going to want you to gain less weight. If you're, underweight coming into the pregnancy, they're going to want you to gain more. So you're going to talk to your provider about that, like ideal weight gain for you. You want to really try and get protein with every meal. In the beginning, when you're really nauseous, sometimes you might only be able to eat saltines and ginger ale, and so don't worry about it too much in the first trimester, but really focus on getting a lot of protein, and then of course leafy greens and good nutrient dense foods. You want to limit sugar, so that's fruit juices, soda, candy, white flour products like cookies, cakes, pastas. Eating a lot of these can increase your chances of having gestational diabetes and can make you gain a lot more weight during your pregnancy, which can put you at risk of certain things. You want to consume iron-rich foods, so like beans, leafy greens, tofu, nuts, dried fruit, red meat. You want to limit the red meat to a couple times a week, just not eating it every day, but it is a great source of iron. Avoid raw fish, but cooked fish is okay. So shrimp, shellfish, tuna, swordfish, it's all fine. You just don't want to eat raw fish, okay? So no sushi. Make sure fruits and veggies well washed, meat well cooked. So you don't really want to be doing any of the rare, like if you have a steak, you don't want it to be like bloody and really pink inside. You want it to be more well cooked. And then no raw dairy, only pasteurized dairy. And if you're going to eat a deli meat, heat it first. And all of these restrictions are really to prevent food poisoning. So Listeria, which is the bacteria that causes food poisoning, can pass through placenta to baby and cause some harm. So that's kind of where all these food guidelines come from. As far as activity goes, it is encouraged to exercise in pregnancy. It's going to help you with back pain, constipation, fatigue, and just get you in shape for labor. You can, walk, run, lift weights, go to exercise classes. If you were doing something before pregnancy, you can just continue those same exercises. If you haven't been exercising, of course, ease into it. Don't just all of a sudden start running or start lifting heavy weights. You'd want to ease into it. But we do encourage it. You just want to avoid contact sports where you might get knocked down, or a big thing at the gym is people, they like to jump up onto these boxes. And those are kind of a high fall risk. So I wouldn't recommend doing things like that. It is okay to have sex during pregnancy, and actually towards the end of pregnancy, it can stimulate labor, like when you're in your late third trimester, which is, what you want. After sex, it can cause a little bit of spotting and some mild cramping, which is normal. If it were to become heavier bleeding, that would be a reason to call your provider or go to the hospital. But if it's just a little bit of spotting, just watch it and monitor it. And if if it's scary or uncomfortable for you to cramp or spot after intercourse, that might be a reason not to have it. So, just something that you can discuss with your partner. There were some, questions about a few different complications in pregnancy. One of them is ectopic pregnancy, where a fertilized egg grows outside of the uterus, usually within the fallopian tube. And you'll see in the diagram that I put on this slide kind of an embryo implanting in the fallopian tube. It occurs in about 1 in 100 pregnancies. It can burst and cause major internal bleeding. So it is a medical emergency. And if someone thinks they have an ectopic pregnancy, they need to get management right away. For just having an ectopic pregnancy, not one that's bursting, but just, having that embryo in the fallopian tube, you might have cramping or pain, usually on one side of the lower abdomen, whichever side the ectopic pregnancy is occurring. Some irregular vaginal bleeding, pain with intercourse. Now, if it ruptures, you're going to have severe pain that sometimes can be referred up into the shoulder. You might have fainting, dizziness, a drop in blood pressure, because if you're bleeding internally, your blood pressure can drop. So if you experience these things, you'd want to go to the hospital right away. Treatment is either a medication that helps break down, if it wasn't a rupture, helps break down the embryo in the fallopian tube or wherever it is, or sometimes surgery is necessary and they need to remove the fallopian tube. Some causes of an ectopic pregnancy can be infertility treatments, history of having an ectopic pregnancy in the past, previous tubal surgeries, if you became pregnant with an IUD, history of STIs, because some STIs can cause scarring in the fallopian tubes. So an egg could get stuck on its way to the uterus. History of pelvic inflammatory disease, and a history of endometriosis. So if you're worried about an ectopic pregnancy, it's not something you should, just kind of watch. You want to let your provider know right away. And if you have severe pain on one side or the other, this is before you confirm that a pregnancy is in the uterus. So this happens very early on in a pregnancy. If you've had a dating ultrasound, they see a gestational sac in the uterus, you don't have to worry about an ectopic. So then if you have right-sided or left-sided pain, it's probably something else. But if this is you're pregnant, but they haven't confirmed that the pregnancy is in the uterus, that's when you're at risk for an ectopic pregnancy. As far as miscarriages go, just the difference between an abortion and a miscarriage. An abortion is when a woman chooses to electively terminate a pregnancy. She might choose to do this for many reasons. Maybe the fetus has an abnormality that isn't compatible with life. Maybe the mother has a health issue. She might have social concerns, financial concerns, not in a healthy relationship. So there's all different reasons a woman may want to have an abortion. Especially with the recent change in laws regarding abortion, every state is a little different about their cutoff when they will do an abortion. So here in the state of Arizona, you have up until 14 weeks and 6 days. If you want to have an abortion after that, you would have to go out of state. So I'm not sure what, I think I said Oregon earlier, but Washington's laws are. You would just have to check with your local laws, and I'm sure Jesse or Jennifer could help you find that out. As far as a miscarriage goes, that is a spontaneous loss of a pregnancy before 20 weeks. And this often occurs before, this can often occur early on if the fetus isn't developing properly. So say, there's 46 chromosomes. We all have 46 chromosomes, and maybe the way the chromosomes form just isn't compatible with life. That pregnancy might just pass on its own. It's kind of like the body's way of taking care of things. 80% of miscarriages happen before 12 weeks. So I kind of, if you've made it to 12 weeks or after, a lot of times you can kind of think of you're in the clear. Not everybody, but it does, a chance of miscarriage goes down substantially after that. Some symptoms of a miscarriage would be leaking of fluid or blood, passing tissue from the vagina, pain and cramping in the belly and the lower abdomen. So if you're having just a little bit of spotting, that's probably not too concerning. But if you're having heavier bleeding, and especially with cramping, that would be concerning for a miscarriage, and you'd want to notify your provider. Now, if a woman has recurrent miscarriages, we define that as 3 miscarriages in a row. Those are considered recurrent, and it can be multiple different issues that could cause that. If a mother has a blood clotting disorder, like she has a tendency to make more blood clots, we see more miscarriages. If somebody has a thyroid problem, lupus is another one, an autoimmune disorder. If somebody has uterine problems, like an abnormally shaped uterus. Say both parents are a carrier for a genetic condition that's not compatible with life, really. If they both pass that abnormal chromosome to baby, the baby might keep passing because it's just not a healthy pregnancy. Cervical weakness or insufficiency. If a cervix can't stay closed and it kind of just opens up, that can cause a miscarriage to occur. And you would need workup and potentially lab testing and potentially some imaging to figure out if you have any of these things. If you've just had 1 or 2 miscarriages, though, that is pretty common. I do tell most of my patients that, most women in their reproductive life will have 1 to 2 miscarriages. So having 1 or maybe even 2 isn't a reason to get a workup, but having 3 or more is definitely a reason. Okay. The next one is placenta previa, and this is a condition where the placenta either lies very low to the cervix, or very low in the uterus, close to the cervix. So it might just be covering part of the cervix, or it might be covering all of the cervix. There's, marginal placenta previa where it's kind of on the edge, or complete placenta previa where it's covering the whole, the placenta is covering the whole cervix. Main symptom with this is bright red vaginal bleeding without pain in the second half of pregnancy. It may cause severe bleeding before or during delivery. So if a woman has a complete previa, she has to be a C-section. The baby can't come out. There's a placenta in the way. And if she were to start to go into labor, she's a big risk of having a lot of bleeding. If the placenta is considered low-lying, so it's not covering the cervix, but it's close to it, depending on how far it is, you may be able to have a vaginal birth, but it does increase your chances of bleeding. So you just want to work with your provider to figure out what the best plan of action is for you. If you do have a placenta previa, you do not want to have intercourse in pregnancy because it can cause you to have a lot of bleeding. This will be found on an anatomy scan. That scan they do around 20 weeks, they'll be able to see where that placenta is, and they can, determine what precautions you need to take if you have one. Then just a couple more here, a cesarean section. There's so many reasons why somebody might need a cesarean section. Maybe the placenta previa, like I spoke about. The baby could be really big. The baby could be breech, maybe meaning the baby's either coming feet or butt first. Failure to dilate, like you've been in labor for a long time and the cervix just isn't opening, or you've pushed for 3 hours, you made it to 10 centimeters and you've pushed for multiple hours and the baby isn't coming down. That's another reason to have a C-section. Maybe there's non-reassuring fetal heart tones, like the baby's heartbeat just is not looking good and they're like, we need to get baby out now. That could be a reason. If you have a genital herpes outbreak, you need to have a C-section because as the baby comes out, they could get herpes themselves and that can cause a lot of issues for a newborn. If it's a twin pregnancy, if you're twins carrying twins and they're not both head down, that might, like if say baby A, usually we label them as baby A, baby B. If baby A is breech, you need to have a C-section. And then maternal anatomical abnormalities, different things could make it so that a woman just physically can't have a C-section. Having a C-section does not mean you are always going to have one. It kind of depends why you had one. If you had one for a breech baby, for example, you're a great candidate to try to have a vaginal birth because you didn't have a chance to labor. But if you labored and you just didn't dilate or the baby wouldn't come down in the vaginal canal, that's kind of a good reason for having another C-section because it might just happen again, and you don't want to have to go through that all again. Immediate complications to a C-section is damage to surrounding organs like the bladder, the intestines, could cause internal bleeding, infection, more blood. We see more blood loss with C-sections, a development of blood clots like in the extremities, like usually in the legs, and then potentially reaction to anesthesia because they give you a pretty heavy-duty anesthesia to numb you. Long-term complications could be development of adhesion. So that's kind of like scar tissue internally, which can be painful. You're at a higher risk of having a placenta previa, again, that we spoke about, and also a placenta accreta, where a placenta accreta is where the placenta actually grows into the uterine wall. So it doesn't just come out after delivery. It's like in the uterus. And so sometimes if a woman has a placenta accreta, she needs to have the whole uterus removed. Those are kind of like the long-term conditions with that. And then there was some questions about lead poisoning. So lead was found in homes built before 1978. Lead was used in the paint. So newer homes, you really don't have to worry about this as much, but like older homes, you want to get an inspection by a licensed lead inspector to determine if you do have lead paint in the home. If you do, or before you have a chance to get your home inspected, you don't want to remodel because as they tear down walls, it's going to create this dust, and that dust could potentially have lead in it. And that's what can be concerning for children. If there's dust from chipping paint or something, they could, touch it with their hands and put it in their mouth, or toys could get in the dust and then they could put that in their mouth as well. So you just want to make sure that you get your home inspected for lead paint if it's an older home. And if so, like if you do see like dust coming from paint on the wall, you want to make sure you're, washing children's hands frequently, cleaning up the dust with wet paper towels, cleaning around play areas and the floors. You could also use like duct tape, like really sticky tape over the parts of the walls that have cracking or peeling until you can get that taken care of. Water pipes could potentially also have lead, so you want to get your water tested as well when you move into a new home. And then one of the ways that you can keep your kids healthy is feeding them things that are that can actually help pull lead out of the body. So that includes calcium, iron, and vitamin C. So foods that are high in calcium would be milk, cheese, and green leafy vegetables. Foods high in iron is lean red meats, beans, peanut butter, and cereals. And then vitamin C, it's high in oranges and red and green peppers and juice. So if a baby is exposed or a newborn, children are exposed to lead, it can cause damage to the brain and nervous system. It can cause learning disabilities. It can cause slowed growth and slowed development, as well as hearing and speech problems. So it's a big deal, I don't want to scare you, but it's just one of those things. If you're in an older home, just make sure you get it inspected. So that is the conclusion. Oh, sorry, no, I have one more, breastfeeding, sorry. The last slide is just about postpartum care. And so when you're on postpartum, you're gonna be working on breastfeeding or formula feeding, depending what you choose. And then when you go home, you may have bleeding for up to 6 weeks postpartum. That is normal. Sometimes it can just be spotting. Sometimes it can stop and then come back. So, up to 6 weeks, you could have some amount of bleeding, and your nurse will go over the warning signs of what is too much bleeding. You might experience baby blues or postpartum. Baby blues is pretty common. It's just when you feel more sad. You might cry more, feel really overwhelmed the first few weeks after birth, but then it starts to get better. Postpartum depression is when these symptoms kind of continue and get more severe and maybe could affect your bonding with the baby, or it could cause you to have thoughts of self-harm. So those would be, at your postpartum visits, you're going to check in with your provider and they're going to make sure you're feeling good emotionally. They're going to also talk to you about birth control. We really want you to space children out by at least 9 months. Having babies close together can be harmful to you and to the new baby. So getting on birth control can help ensure that you don't get pregnant right away. You want to practice pelvic rest and light activity for up to 6 weeks postpartum. So no sex, no going back to the gym. You can go on little walks and things like that, but take it easy. Your body's healing. And then you want to continue your prenatal vitamins and iron if your iron levels are low. Usually around 6 weeks postpartum, though, you can stop those things. But again, talk to your provider so that they can kind of guide you in that. So that's all I have today. If you have any questions, again, Jesse or Jennifer might, they have my email and they can always reach out to me and I could, do an additional couple slides. But good luck to all of you. I hope you have wonderful pregnancies and births, and happy summer. Okay, bye.